right, welcome back. And this morning on Your Health, a new psychedelic drug that's being talked about as a possible solution for addiction.
It is not legal here in the United States yet, but advocates are pushing for more research to see if it's really as promising as some say. Our senior national correspondent, Kate Snow, has been following addiction and treatments like this for years. Kate, good morning to you.
Yeah, good morning, guys. This really could be a game changer for the 3 million people in this country who are fighting or have dealt with opioid addiction. We're talking about a psychedelic drug called ibogaine. And look, it has some risks, but some people who've traveled to other countries to take it say it changed their lives.
For people battling opioid addiction, help can be hard to find. Only 1 in 5 adults with opioid use disorder received medications to treat it in 2021. Those that take medications like methadone or Suboxone alongside therapy are sometimes on those drugs for years. But what if there were a treatment that could change things overnight? Ibogaine comes from the root bark of a shrub in Western Africa, and advocates say with just one treatment lasting 12 to 18 hours, a person who was addicted can walk out clean. Alan Davis is director of the Center for Psychedelic Drug Research and Education at Ohio State and authored a study on the effectiveness of ibogaine. Is ibogaine working for some people?
Ibogaine is working for some people. The best evidence that we have is about 30% of people will remain abstinent from opioids after using ibogaine.
Compare that to the success rate for current rehab treatments at about 20%. How many times did you go to rehab, Bobby?
I went to 2 inpatient rehabs, and then I went to several outpatient rehabs where, in essence, they prescribed Suboxone or some equivalent, but there was no, inpatient component to it. 6 or 7 times at least for outpatient.
Bobby Laughlin is married now with 2 kids and a career, but 10 years ago he was deep into a heroin addiction when he traveled to a clinic in Mexico to try ibogaine. Like many who've used it, Bobby says he felt like the ibogaine trip helped him understand why he started using drugs to begin with.
I was laying down in a bed. A gigantic hand comes up and grabs my entire body and pulls me into the ground.
And there was a voice?
Yes, the voice was like a strong masculine voice that was yelling, and it was scary and basically telling me that the reason I'm in this experience was all due to my decisions.
When Bobby woke up, he had no desire to use and has never used since. What are the feelings around that?
It's just very intense to reconnect with yourself again. After having been so far removed from yourself, it's like getting to know an old friend. Especially, it's a friend that you may not, it's like I never knew that I would see him again.
You didn't know if you would live.
Right.
There are some documented heart risks with ibogaine, which isn't legal in the U.S., and some worry about danger with unregulated foreign clinics. Alan Davis says no one's quite sure why it works.
One of the things that we think is happening in the brain is that it is having an impact on the reward center of the brain, and that's one of the rewarding cycles that people get in and what causes them to relapse.
Important to say that Bobby's experience is not everyone's experience. As Alan Davis said in the piece, about 70% of people who try ibogaine do relapse, but that is less than the percentage who relapse with current treatment options. Experts emphasize this drug has to be taken in a medically controlled environment where they're monitoring for side effects, and everybody wants more research. Kentucky, a state that's had so many deaths from substance use, is actually discussing spending $42 million to fund ibogaine research. Guys, if that passes, they would then have to get FDA permission to do trials. But a lot of hope around that could be a next step, because, again, right now it's illegal in this country.
And there's been so much research going on about the many different psychedelics and whether they can treat other mental health illnesses like PTSD, for example. So this is kind of a piece with that.
Yeah, but you look at Bobby, 11 years almost he's been sober now.
And the way he described how he emerged was so profound, I thought, seeing an old friend. But wow, the fact that he hasn't used is really telling.
Well, the reality is there are millions of people in this country who have suffered mightily with addiction for a long time. So we need some solutions.
Yeah, that's exactly why Kentucky's looking at funding it.
It's a great story, Kate.
Thank you, Kate.
Hey, thanks for watching. Don't miss the Today Show every weekday at 11 a.m. Eastern, 8 Pacific on our streaming channel, Today All Day. To watch, head to today.com/allday or click the link right here.